Hi there, and welcome to Canceling COVID. I'm Tanya Rivens. So glad to have you with us on this Tuesday, as we're here every Tuesday at 11 a.m., bringing you information and keeping you updated about what's happening in our community. And here we are, folks, the first Tuesday in August. And if you go back to August of last year, we had started to see some spikes happening in the world of COVID. Well, it looks like there's a repeat happening. The numbers are starting to spike again. We mentioned that on last week, and here we are again mentioning it again because the numbers continue to go up. Of course, let me start by saying Canceling COVID is about real talk, real solutions, and resources. And we bring people on to speak to you, to make you aware of what's happening in our community, to answer your questions, and just to let you know there is someone working to bring you the information that you need to hear. So again, thank you for joining us. Thank you for taking time out of your day. A nice day in the Queen City. And for those tuned in in the Facebook world, we say thank you for tuning in. If you are a familiar viewer of Canceling COVID, then you're very much aware that I don't do this alone. I always bring on our in-house expert, and I'm referring to none other than Dr. Tricia Black, who joins us every week. She's a part of Groundwater Solutions, groundwater-solutions.org, 704-596-0505. And Dr. Black, good morning, and thank you so much for taking the time to join us.
Good morning. Thank you for having me this week.
Absolutely. So, as usual, we'll dive right in and go ahead and talk about what is really at the top of minds for so many people, and it's the spike that's happening. We talked about it last week, and you said, when this trend starts, the numbers continue to go up before they start to go down. And there are quite a few layers because we've been dealing with this for so long. We'll be heading into 3 years.
Yeah.
Yeah.
March of 2020 is when the United States woke up to the COVID-19 virus.
Right.
I think it was here much earlier.
Right.
But I think that's when we became aware and realized that our communities across the country needed to take action.
So here we are again, and I just recall this happening last year because I have my annual outdoor event every year in September. And one of the things as people are, doing nonprofit events, you start trying to figure out, okay, where are we going to be? And what should we do? So, so many people have already been vaccinated. What should people do right now as the numbers start to spike? No surprise that Mecklenburg County is now in the red zone. Of course, that's based on cases, the use of hospital beds. It's been determined that losing lives to COVID is still low, although, any death is significant. And the last report I saw was maybe hundreds right now for the whole country, which adds up to, of course, hundreds turn into thousands, but nothing like the numbers that we've had where we lost over 1 million people. Right. So just speaking right now, what would you recommend that people do?
I think, Tanya, that it's very important that we still take precautions to slow the spread. I think for the most part, many of us are either vaccinated or we've built up an immunity. I'm testing people now, and for some, it's their third time around with COVID-19. So they are having symptoms. The symptoms are there. They're, severe to mild cold-like symptoms.
So let's talk about the symptoms, just to jump in for a minute, because you said the symptoms are there, severe to mild, but they're cold-like, which is that chills, sneezing, coughing.
Correct. Chills, sneezing, fatigue, body aches.
Okay.
The coughing is definitely there, itchiness in your throat, diarrhea. Those are things, and I have told my patients that diarrhea is a good thing. If you feel that, that's your body naturally trying to flush the toxins and the virus out of your body. So that, dehydration is a challenge because you are having the diarrhea, you may be having cold sweats, and you want to make sure that you're replenishing with plenty of fluids.
Are people just not getting it as far as changing their lifestyle, as far as healthy eating and exercise and things like that? Not saying that's the only solution, but do you think maybe people are just overlooking that aspect?
I don't think that's happening, Tanya. I think people are healthier as a
Okay.
whole collective. I think we are healthier than we were in 2019,
Okay.
coming into 2020. I think a lot of folks have changed their diets. You see the vegan restaurants popping up, or
Absolutely.
restaurants who are now offering plant-based options
Hmm.
because the demand is there. We're eating differently. We are walking. We are doing natural and holistic type strategies, IV hydration, different things to improve our health. So I think we are healthier. We have the extra immunity, but that does not stop the spread of the virus. And the challenge is everybody's not healthy. We still have many pre-existing conditions. So it's important that we do things to moderate the spread. My concern right now is that, because we're so COVID fatigued, that people are seeing this spike, but they're not making any changes whatsoever in their behaviors that will slow the spike. And that means that it's going to reach a larger number of people. If we are in large congregate indoor settings, it's going to spread like wildfire. And then we're going to take that virus home and it's going to spread through our families. We're going to see those escalating numbers again unless action is taken.
So what action should be taken right now? I mean, a health department, bless their heart, especially public health, they've got to be overwhelmed. It just seems like it's one thing after the other. We're trying here to do our part to keep it topical, keep talking and keep staying okay. And I know it sounds like a broken record, and canceling COVID, obviously it could seem like it's a parody, but certainly we're determined to keep the conversation going. We know it's never going to leave. We've been made aware of that. But what I just wanted to say is your suggestion for what people should be doing right now.
Well, I think we should take personal choice and personal responsibility to protect ourselves and those that we love. I've talked to a lot of parents and said, tell your kids they have to go back. We remember the early days. And if you think about March through probably June, July of 2020, you went into stores and you touched very little. You touched only the things that you needed to essentially touch. You just changed the way that you interacted publicly. And I think we need to return to doing those things. There are challenges to that, though. Some people went out in gloves, and you had not only your mask on but your gloves. We would be able. North Carolina had a stockpile of PPE. Personal protective equipment. We don't have that stockpile anymore. So we were able to order gloves and order gowns and order masks and distribute it to the public. I tested a family on Sunday and they were positive. And the mother asked me where I went to the store, I couldn't find gloves. And a lot of that PPE is not there like it used to be. So we have to, and we can't order it and hand it out to you. So you have to be able to know that restrain yourself from touching. The virus is spread from our breathing, being in close proximity to other people who are positive, who are breathing, and you're getting those droplets of the virus. And it's spread by touching something that someone who is positive has touched. So if we refrain from doing those things, I think we're going to be far ahead in the game of protecting ourselves and our families.
It's all in the hands, and clearly, obviously, the mouth and nose. So the masking, which is now required because Charlotte has Mecklenburg County's back in the red zone. But I've been in very few settings. I walked, and I'm not going to say what office, but a dentist. I just said it, an office. And no one in there had a mask on that was in the waiting room. And I looked at and I said, why they don't have masks on? And she's like, oh, they're supposed to. And I'm going, oh my goodness, we've gotten this relaxed inside. And most of these major medical centers, you can't walk in the door without a mask on because they know the implications. So I think just if anything else, we got to get back to our basics, which is what you've been saying all along. I don't know if you ever took your mask off.
I have not taken my mask off.
But back to wearing the mask, and if you're not doing the gloves, then keep your hand sanitizer close by. That's one of the things that I told you all along. I just love the smell, love to do that, wash my hands, and just be careful. Even as soon as I get back in the car, putting those things on. You mentioned large gatherings. I know outside it's going to be really tough to convince people, but inside, a lot of ministries never dropped the mask mandate, and I see a lot of them going back to it. That's probably one of the larger gatherings that people have. I think going to concerts inside, in the summertime, that's a lost cause. So it's going to happen. But what for people that say, you know what? Okay, here's another variant. We're going to live our whole lives afraid of these variants. The number of deaths are down. People are recovering quicker. The symptoms are minor. Is that a bad thing?
Well, it's not a bad thing because I don't think we should walk in fear.
Okay.
That fear is not necessarily helpful because that leads to a pandemonium. And I think, we talked about a little bit earlier about monkeypox when we were offline, but across the world, what we don't want to happen is another pandemonium type event with monkeypox. So we're holding information close to our chest. We're not putting a whole lot out about monkeypox. The numbers are rising, but they're not to the point where information, vaccinations are being widely distributed. It's still in the hands of public health because, we don't want the same reaction. Right. With COVID-19, I was talking to one of my relatives and they said, well, we're not really even seeing it on the news. There's no mention of COVID. Well, it's because we don't want the fear again. But that does not mean that action should not be taken. And we don't need to be afraid to address it in our communities. We don't need to be afraid to address it in discussions because it's still here. The numbers show that it's still here, so that we have to take some type of action.
Yeah. And I would speak to your cousins or whatever. There are media reports out. I'm just not sure. Clearly, we're not connecting the people that need to hear it because there are reports. It's not a lead story. That's for sure. But, online, and I challenge people to use more of a variety of outlets to get their news stories, whereas before people relied on just one media outlet. You can't just do local media anymore because there's so many options out there for you. I don't know if it'll ever return to being the main story until we start seeing areas shut down. And of course, there's been some areas that have been declared a public health emergency based on the monkeypox, which we're going to talk more about that. After you and I finish, I'm going to share some more information along those lines.
But I don't think that it should return to be a main story.
Okay.
Is what I'm saying. I don't think that should be the case, but there should be some guidance out there to say, okay, we're, like they have the reds and the yellow and the orange alerts.
Right.
And we have those about different things, not just COVID-19. We should still implement those. But I think we're at this stage where people are so tired of hearing about it that they are not responding. So they want it to hit the major news lines and be front page again before they take notice. And it's just not going to be there. So if that's what we're waiting on to say, I need to put my mask on, it's not going to happen. But what we're going to see is those numbers really spreading. You're going to see businesses shut down again unless we take the precautions. And nobody wants to go back to that.
Yeah, and I'm gonna be honest with you. I don't even see that happening unless it would have to be. I just don't see that happening. Don't want to even think about it because of how it crippled the economy and all of the vision and everything. And as a small business owner, you and I both know we can't even afford that.
Exactly.
Because what happens is,
I tell you what's going to happen is going to happen because someone in the business, if you think about a restaurant and you walk in that restaurant and there are no masks.
Right.
Where we are today, somebody in that restaurant who works there is going to contract COVID. They're not going to be masked. And then, within about 3 to 4 days, everybody in the restaurant is going to have COVID and that restaurant is going to be shut down for that period.
Absolutely. But to that point, we're not, and you said that the symptoms are a lot less, they're more mild than what we had in the first variant, though, correct? Which means it took about 2 weeks for recovery. It took a long time. So I guess what you're saying, it'll shut businesses down for a few days, possibly.
For a few days.
Right. Okay.
While they or their staffs are recovering.
Absolutely.
They will not be able to function. And as a small business, and we're in this this time where we're all trying to recover financially. We're trying to recover with our our employees, getting everybody back stable. In my industry, I'm in healthcare, and we got to this point during COVID where everybody was doing telehealth, and they like it. They like working from home. How many businesses are not able to get their workers back out? And so we've gotten to the place where we're trying to pull these folks from behind their computers, but we're now at a place. I had to make a decision yesterday to have a meeting, an important meeting virtually, because I did not want to put 70 people in the same room. But I also don't want them to think, okay, now I can get behind. See, I should have stayed behind my computer. No, we've got to live and we've got to function as a society. But so we have to learn when to take the breaks. When I'll do virtual today, so that I don't have everybody in my office out of work for the month of August.
Gotcha. Good stuff.
So that's a precaution that I'm suggesting, that your houses of faith, your businesses, that dentist office, is the same thing. Put the mask on, do virtual meetings instead of putting more than 10 people in the same room, are the things that I suggest, so that your businesses, your organizations can continue to function.
Absolutely. So, Dr. Black, as we wrap things up, of course, Groundwater Solutions, groundwater-solutions.org, 704-596-0505. What would you like to leave with everyone and kind of give us an update of what's going on with you?
Okay. So I will say that we are still providing testing. We have drive-up testing in our office. You drive up and you call the number on the screen, 704-596-0505. We will test you regardless of whether you are insured or uninsured. Even though the funding is not available, we are making testing available. At this point, we're not doing large mass testing, but we are doing individual testing as needed. If you have symptoms, or if you know that you have been exposed to COVID-19 because somebody in your circle is positive, I do suggest that you get tested, and tested immediately.
Thank you so much, Dr. Black. We certainly appreciate you always just having this conversation. I always feel like it's just two girls kicking it and letting everyone know, these are the conversations that we've got to have and we should be having more of. And you'll be surprised, and maybe not, the notes that I get from people saying thank you, good information, just thanks for keeping the conversation out there. And of course, I couldn't do it without you. So I appreciate you always making time, and not just making time, but supporting this effort as we continue to have the conversation about canceling COVID. All right.
Thank you for leading the way.
And so as we continue this conversation, just to recap, on July 25th, just in one day, we went over to the red zone here in Mecklenburg County. And of course, again, that's the high exposure. So you're supposed to be wearing masks indoors. Just to remind everyone, when you're inside, wear your mask. And just to put in perspective, in Mecklenburg County from March 12th through the 19th, we had only 289 cases of COVID. From July 17th through the 23rd, so keep in mind, less than 300 from 12th through the 19th of March. But July 17th through the 23rd, we've had 3,866 cases. That's close to 4,000 cases. So that's over 1,000% increase in the last 2 weeks in this BA.5 variant. 58% of all the cases, which if you're like me, you're not a scientist, so those are numbers, but certainly we can see the staggering difference of where we came from, less than 300 to close to 4,000. And that's according to the North Carolina state health officials. Now, the yellow zone is where there's just a significant community spread. We were in the orange zone, which was a substantial community spread, and now we're in the red zone, which is a critical community spread and is based on diagnoses as well as hospital beds. We can be encouraged that the symptoms are not as severe, but certainly concerned that people are experiencing it, and people that have other health problems, this could be very uncomfortable for them. We talked a lot about this last week, and we're going to keep uplifting it. And please share, let people know we're having these conversations because of COVID. It's not going anywhere. We've got to make the adjustments. And right now it's up to us to remember that the risk of getting it is that we be careful when we're gathering, meeting outdoors, but certainly masking inside. And we just joined some other neighboring counties that were already there. So we knew it was a matter of time. I shared last week, Rowan, Cabarrus, and Gaston, they were already classified as high risk. And that was on July 25th. And so here we are back in the same place. So please do your part. Share the information, let people know, we can't take this lightly. And what we're going to do now is do a shift. We don't have a whole lot of time left, but certainly enough time to talk a little about monkeypox, which Dr. Black and I was talking about, and I'm working to get an expert on as well. The World Health Organization declared it a public health emergency of international concern. And there are 3 states right now that have already said that it's a public health emergency, and that's New York City, California, and Illinois. So for North Carolina, the amount of cases that we have, I got the numbers from Mecklenburg County, 1,800 people on the county monkeypox vaccine wait list, and the county is getting additional doses this week to help around 1,000 patients. So there is a vaccine that's available. I have by no means would I be in a position to even speak on this, and so I already misquoted, not the cases. This was the amount of vaccines that are being offered, and people on wait lists are looking to do it. Here's the thing. There's a vaccine available. It's just getting it out and getting it in a timely manner. So I'm going to pull in just a report real quick from none other than CNN to just kind of share some background because I tried to grab something from the CDC. And sometimes it's not about the source, it's just what you can grab as quickly as possible. So I'm going to share this with you to give you a little bit of information, and then we'll do a couple of comments around this as well. So here we go on this conversation, a look at a monkeypox.
What you're looking at are monkeypox lesions on 33-year-old Adam's arm, legs, face, even his eye.
Right underneath the eyelash next to the eyeball.
The previous week, he had gone to a festival, and after he returned, he received an email from festival organizers saying someone who attended had monkeypox.
The last exposure that I can think of was on the 3rd of July. And then by the 11th, that's when I first noticed the marks on my arm.
That's important. It's called the incubation period, the time between being exposed and first developing symptoms. It can be anywhere from 6 days to as long as 21 days in this outbreak.
And then by the 12th, that's a full-on fever. So that was 9.
Within 3 days of getting that fever, Adam continued to break out in rashes, even in the back of his throat. And those were the worst. For days, Adam could hardly eat or even speak. The only thing that seemed to help, gargling with lidocaine solution.
Had you ever experienced anything like this?
I would kind of liken it to a crossbreed between COVID, strep throat, mono, in addition to the pox.
Dr. Stacy Lane is founder of the Central Outreach Wellness Center in Pittsburgh. It's a center focused on LGBTQ health. She is also Adam's doctor.
He had a lesion on the inside of his lid, but if that would rupture, he would auto-inoculate his eye.
Turns out about 25% of people infected with monkeypox do develop lesions around their eyes. And if the infection spreads to their cornea, it can cause blindness.
And that was what pushed me to treat him.
That's right. There is a treatment for monkeypox. It's an antiviral known as T-pox. It's been approved since 2018 in the United States to treat smallpox. That's a virus in the same family as monkeypox. And recent studies have now shown effectiveness against monkeypox as well.
What are you seeing in terms of response to this medication?
Honestly, it's been profound to watch the progression through pictures and literally melting away within, I would say.
And so let me remove that. I was trying to catch it before we got to that point, but that gives you an idea and a great setup for what we are now facing. And here has been the complaint, the information being distributed. And Dr. Black and I talked about that off the record. The complaint about how it's being, the information is being distributed, as well as access to vaccines. So I share with you 1,800 people on the vaccine wait list in Mecklenburg County, and that the county is getting enough additional doses this week to help around 1,000 patients. So how many cases have we gotten diagnosed here in Mecklenburg County so far? a total of 33. In the state of North Carolina, a total of 60. So this is starting to spread the conversation around the distribution of information as well as the rollout of getting these vaccines. That you see, there's a vaccine that's available, shared in the video, a part of smallpox that has also been around. But here's the thing. The concern is that it's been passed around in the gay bisexual community as well as trans women. But your family members, because it can be skin to skin contact, and even if you're sharing, say, a towel or even on bed sheets. So this is where people start to get really concerned. Say if you're going to visit, say, in a hotel room and you've trusted that they've washed the linen and washed the towels and you feel safe there. These are thoughts that are going through people's head. I think there was even mention of someone who said she got it from touching money. And I saw a report where that was not verifiable. And of course, you're going to have some unique, I guess, cases, and that's not a guess. Things will happen along those lines. But what we want to do is continue to make you aware that these things are happening and that you're sharing this information with others as we continue to navigate this thing called what life. How's your mental wellness? We can still handle it, not to be overwhelmed, just to let you know this is what we continue to deal with and to keep you informed, keep you updated. And certainly we've got our young people getting ready to prepare to head back to school. So we got to take those precautions in mind as well as we start to navigate returning into crowded buildings. And oh gosh, I'm sure the school system is saying, not again. We've got to figure out how we're going to protect these babies as they start to congregate again in a small area. So a lot still ahead. There will always be a lot around this conversation because the pandemic, it's not going anywhere, but we're going to keep this conversation going because we have no intention of going anywhere either. So also let me say thank you to Atrium Health. Always when you share, you can always use the hashtag Atrium Health COVID vaccine ambassador. I work with them on bringing this every week as well to get you informed and make you aware. And if you got COVID symptoms, you know, those COVID tests, you should have some in your home right now. They still have some available at last check, covidtest.gov, covidtest.gov, or call 1-800-232-0233, 800-232-0233. A lot of people that are feeling the symptoms, they get tested and they just kind of isolate themselves. And as we shared earlier, of course, it varies depending on your health. But if it means removing yourself for about 3 or 4 days, you're doing everyone a huge favor. Really, you are. And sometimes you have to take one for the team. Now you're really taking it for your neighbor and showing that you're really concerned about what's happening. We're going to dig out of this, I'm sure, to where it will be more manageable. Last week, we talked about everyone pretty much is now, at least not everyone, but a large percentage has been vaccinated. A lot of people have gotten boosted maybe twice. But looks like heading into the fall, there's going to be another booster that's going to be needed. And obviously, you have the option to do it or not to do it, but it's something certainly you might want to start talking about and considering as well. All right. Hopefully there's something that you're able to learn from this conversation today. I'm so grateful that we're so committed and you're committed to joining us each and every week. Again, it's Canceling COVID. Thank you to Groundwater Solutions, groundwater-solutions.org, 704-596-0505. As for me, I'll see you on this Saturday. I'll be listening for you, kicking off at 10 a.m. Sounds of Inspiration, Praise 100.9 FM. Tonight, National Night Out. It's an opportunity to build community relations with law enforcement. They are all over the city. Find a location, just stop by and say hi. You know, we call on law enforcement. We know we don't always have the best conversations with them because usually you're in distress when you're calling on them. But here's an opportunity tonight for you to say, you know what? I appreciate you. Even when I don't agree, I appreciate what you're doing. So find a location. I'll be at Bailey Road Park tonight at 6 p.m. That's in Cornelius. And again, they're all over the city. So you can find a place. Just stop by. And typically, they've got some really nice giveaways and free food too. All right. As always, life's challenges make you better, not bitter. I'm Tanya Rivens. Be well, be safe, be alert, and check on your neighbor. Thanks for tuning in to Canceling COVID. Real talk, real resources. And of course, we are about the community as we continue to keep you informed about what's happening in our community. We feel like together we'll keep this conversation going and eventually we'll have a handle on this thing called COVID. Enjoy your day, everyone. Get out, enjoy the weather, but certainly stay cool. Take care.